Hey everybody, my name is Jonathan Willis. I am the lead trauma instructor with Gunset Training Group in Dayton, Ohio, birthplace of aviation, remember that. But Tim asked me to join you all today to talk about a few things that you all can be prepared to do on the range and in your day-to-day life if you are confronted with an emergency situation. And we're going to talk about this in the context of the range world, but all of this applies to anything that you should be confronted with in your day-to-day life, in home, as you at school, or whatever you might be doing. So these are really important lessons and really important tips that you can carry with you in your day-to-day. But specific to the range, when we're working on the range, we want to make sure before we participate in any range activity that we have a range safety plan in place. This is vital. This is the most important thing so that we ensure a safe and enjoyable time no matter what goes down. So it's always about learning and having fun, but most importantly, it's always safety. So certain things have to be in place. We want to make sure that we have an action plan if anyone is ever injured or ill on the range. So we have things like trauma kits stationed on the range. We have things like AEDs in place for those unforeseen circumstances. But let's get into some of the nuts and bolts about what you may be able to do if an emergency does take place. So one of the first things we think about in the range environment that might take place is someone get injured by a projectile, by maybe a ricochet or something like that. And those are often bleeding emergencies. So one of the first things we think about is that arterial bleed emergency. And that first most important tool is the tourniquet. Tourniquets are for uncontrolled arterial bleeds. There are 3 times in which we apply a tourniquet. And the first one is an uncontrolled arterial bleed. That is bright red spurting blood. The second one is any amputation. And the third one is any bleed that is uncontrolled by every other means possible. So those are the 3 times we might apply a tourniquet. Remember those points for tourniquet application? Just get it high and tight. So we apply that. This first step is the most important. It's nice and tight. We twist and twist and twist until that bleeding stops. We lock it in. We set that strap in, and then we close our strap. We may document a time on it if we have a marker handy, and the same would be for the leg application. This, of course, is our CAT tourniquet. There are a few different models on the market. This is the one that I work with the most, but the tourniquet is a great immediate action tool. I carry one of these with me in my day-to-day, but these should be very close at hand anytime you're working on a range. But that's for an arm or a leg arterial bleed. But sometimes we have bleeds that may not be able to be fixed with a tourniquet. And these are called junctional hemorrhages. Junctional meaning a junction or a place at which a tourniquet can't be applied. And this is generally the neck, the armpit, or down where your legs meet your torso, the groin. So neck, armpits, or groin. Those are called junctional hemorrhages. And often we will have to pack those wounds with something called combat gauze or normal gauze. Either way is fine. Combat gauze just makes the clotting initiate faster. However, if you have simple gauze, that will do the trick as well. So having both of these or either of these is a good option. If you have neither of these, a t-shirt or anything like that will do in a pinch. But the important thing is that if a bleed is taking place of an arterial nature in a place where you can't apply a tourniquet, any of those locations, it's important to get that wound packed with a gauze or a fabric to get that dangerous bleed stopped. Those arterial bleeds are very, very dangerous, and that's an immediate action, especially in a range environment. But this does happen in car wrecks, sometimes when people are out in their day-to-day work. So these can happen in any place, so be prepared for that. A lot of bleeds take place or happen on a part of your body that can absolutely be controlled without a tourniquet. In fact, most bleeds can be controlled by direct pressure. And that's still our go-to. If it can be controlled by direct pressure, we want to do that. And we use a simple pressure dressing. A pressure dressing would be available in most kits you find. And it is simply that. A pressure dressing would be a dressing, looks kind of like an ACE bandage. It's a little bit stretchy. And you see here, other side towards wound. And you might have a wound on your arm, and you simply wrap this around it and keep wrapping, and it applies a little bit of extra pressure on that wound, and it keeps wrapping it around. And oftentimes, something like this will be sufficient to stop a bleed. Even a more distant arterial bleed can often be stopped with a pressure dressing such as this. So know your methods of bleeding control. That's a vital first and often most probable situation. So that's bleeding control. Stay up on that bleeding control methods, both at the range and in your day-to-day life. So another concern that often presents in the range environment, especially down in North Carolina where it can get pretty hot, is heat stress. A lot of times people have too much caffeine, they're drinking those energy drinks instead of that water, and we get into heat stress, dehydration, and sometimes the sun just gets to people. So we'll have just simple heat stress, heat exhaustion, or heat stroke. And when you see these symptoms coming on people, oftentimes they'll start with just simple kind of exhaustion. And it can progress up to flat out, they'll be kind of out of it a little bit, up to the extreme being absolute unconsciousness in a point called heat stroke. This can often be noted by, it's very, very hot, and they're past a point of even being able to sweat. So if you see someone whose skin is flushed, it's really hot outside, their skin is flushed, but they're still dry, that's an indicator that they're kind of past the point and in a dangerous heat emergency. So when they're in this condition, whether it be a heat emergency or a cold emergency, get them out of that environment. You'd be amazed at how much of a difference just getting them to the shade is. So you get them out of that heat environment, that hot, humid environment, get them to a cooler environment, and do everything you can to get them rehydrated, get them cooled. If it is to a point of compromising, say, their consciousness, their level of consciousness, it is a dangerous, dangerous emergency, and they need medical attention. So keep that in mind. But the number one way to avoid this is prehydration and rehydration. So keep that in mind on the range as well. Heat stress is probably the most common issue that we see in and around the range, is folks just ignoring the extremes that we work in on the range. So keep that in mind. Get them out of that environment and get them rehydrated, get them cooled. A lot of times if they catch it early enough, they'll be able to get back out and get back to some range fun and get back at it. But keep that in mind. So sometimes on the range we're moving around a lot and we might have an ankle sprain or a strain. Sometimes it may be a break. And if you see something like this happen, one of the first things you want to do is don't start moving or trying to rearrange a broken or what we would call angulated limb. I think sometimes that's almost a reflex of people. They want to put it back the way it was. If you see something this way that was supposed to be that way, don't just reflexively put it back the way it was. That can be a very dangerous thing as well. In the field, I'm a paramedic, and in the field, when we find something that's angled, we'll splint it in that condition if it still is circulating blood and everything's like, we'll keep it in that position. We don't change it, except for very, very rare and specific conditions. So don't rearrange something. Don't do that. But you want to try to immobilize it. And the way it was, oftentimes the best way to do it would be a simple sheet or blanket or pillow. Sometimes folks might have something like this. This is called a SAM splint. You'll find it in a lot of simple range kits often. And this is a real simple bendable little splint. And you can actually shape it to the shape of someone's limb. You see here, I could literally make it to the shape of someone's foot or something like that. And then you take your gauze and wrap it around, and you could make a nice splint and wrap it around someone and just kind of keep someone in a good splinted position. And truth be told, that old Boy Scout method of splints and stuff like that with sticks or a straight object that you might find in your environment does actually work. Otherwise, I do love pillows. You'd be amazed how many times when working as a paramedic, I would simply use a pillow or a blanket and fold it around an arm or a broken foot or a strained foot. Those work wonders. And if it is an injury where they do have to call a medic or an ambulance or take them to the hospital, that will protect them in that injured limb in the meantime. So consider that. That can be a very helpful thing for the medical professionals that are eventually going to help them. It'll also keep them more comfortable as they're waiting for help to arrive. So keep that in mind. If you see a sprain or a strain, don't move it around very much. Also, don't let them bear weight. If it's a lower limb, a foot or an ankle or a lower leg, don't let them bear weight on it. Just keep them still and support them. Let's talk about eye injuries. We're firing projectiles. Sometimes we're firing on steel or there can be a ricochet or things like that. And eye injuries can happen. If someone even when you're wearing appropriate eye protection, sometimes eye injuries can happen. It can come in the sides, top, bottom, what have you. Things can happen. You want to, if they have a single eye injury, you want to cover both eyes. Okay, because if you cover one eye and they're still looking around with the other eye, that covered eye is still moving around and can further the injury. So if they have something in their eye, you want to cover both eyes and support them and keep them from moving those eyes, especially if something's around and they're moving it around. If it's a little piece of metal, it can actually tear things up a little bit worse. If the best thing to cover their eye best thing to cover the affected eye with is them to simply close their eyes and keep their eyes closed. And then if you need to be, you can cover with a bandage or something like that. Some kits come with these little eye covers where before you wrap them or something like that, you would cover this. And that's a little plastic shield. Those can be helpful as well. Sometimes if there's a really bad eye injury and you put fabric against it, it can actually draw fluid out of the eye. So we want to have a barrier, be it the eyelid itself or something like this. You want to not have fabric that's absorbent directly touching an eye if it is open. But if they can close their eye, or you can use one of those eye shields or something like that, that's a helpful thing. But cover both eyes when you possibly can. Eye injuries definitely need medical intervention, and you need to keep that in mind. So another thing we need to think about always are cardiac emergencies. If someone is in this environment, they're working really hard, sometimes people will have cardiac chest pains, cardiac events, or cardiac arrest, and you need to be aware of that. CPR is a vital, vital life-saving tool that we should all be aware of. A couple of 100,000 people die every year out of hospital from cardiac arrest, and we need to be up on that CPR. Hands-only CPR is perfectly appropriate. If the only thing that you can do is do compressions and do them well on a person who needs them, that is a wonderful thing. So if someone starts to have chest pain or any kind of event like that, you want to get them out of the environment immediately, and you want to activate 911, okay? This is important. Time is vital if someone is having a cardiac event. Get them out of the environment, activate 911 immediately, and ask them questions if they have a history of anything like that. You want to find out if this has happened to them before. You want to get all the information you possibly can, and they actually might have some information for you. They might say, you know, I have a medication that I need that's in my car, go get it, or it's in my pocket, or it's in my range bag, and you get that going. Now, if you find a person unconscious, or if they fall unconscious, you want to try to shake them or arouse them for 10 seconds. If after 10 seconds they don't respond to you, it is time to begin CPR. And you initiate CPR, fast and hard compressions on the chest at a rate of 100 to 120 times per minute. Go and go hard. Do the best that you can. If you can have someone relieve you, go for about 2 minutes and then get a relief. That's about the best cycle we find in the professional environment, and that can help them a lot. It'll increase the probability of their survival as quickly as you possibly can. If you're at a range where they have an AED, get that AED into operation. And most of them, it's pretty obvious how you get them going. It's that green button. They'll start talking to you. It'll start giving you orders and instructions of how to move forward and get electrical current delivered to that heart, and hopefully achieve a life-saving outcome. So these are a few really, really helpful tips that I think are vital for any kind of range activity. I think that everyone on a range should be aware of all of these things. I think that you are on the right steps to be empowered for the best safety outcome on a range. If you have any questions about any of this, you have Tim get with me and I'll get you an answer. Otherwise, I hope you have a safe time always on the range. Keep working hard. You're doing great things, and I'll talk to you soon.